Hello there, my name is Sylvia Dominguez, and I'm with Dominguez Insurance Services, your trusted Medicare health insurance agency. I'm so glad you've joined me for this guided Medicare 101 tour. My goal is to make Medicare basics simple and even a little fun for you. Let's dive in and get started. Thank you for taking this Medicare journey with me. If you have any questions or need personalized guidance, give us a call. We'd love to help you find the right plan for your needs. I look forward to hearing from you soon. Medicare is a federal health insurance program providing vital coverage for individuals aged 65 and older, as well as younger people with disabilities or specific conditions like end-stage renal disease. It's designed to ensure access to quality health care when you need it most. To qualify, you must be a U.S. citizen or permanent resident, have worked 40 quarters or 10 years in the U.S. These work credits can come from a current or ex-spouse. Most people become eligible 3 months before their 65th birthday during the initial enrollment period. If you're under 65, eligibility may come through Social Security disability benefits or other qualifying factors. Let me share a quick client success story with you. This client came to us with no health insurance because she was initially told she didn't qualify due to never having worked in the U.S. We explained it was possible to qualify for Medicare under a current or ex-spouse. She shared she had been divorced for several years but had never remarried. She reapplied under her ex-spouse work credits and qualified for Medicare, and eventually Medicaid due to her low income. Although they are often confused for one another, Medicare isn't Medicaid, also known as Medi-Cal for Californians. They're different programs serving different needs. Enrolling on time is critical to avoid penalties and secure continuous coverage. Ready to make the most of your Medicare benefits? Contact us today to learn how we can guide you through every step of the process. Medicare Parts A, B, C, and D. Medicare is designed to meet different healthcare needs through 4 key parts. Part A covers hospital stays, skilled nursing care, hospice, and some home health services. It's often premium-free if you or your spouse worked and paid Medicare taxes for at least 10 years. Think of Medicare Part A as hospital coverage. Part B includes doctor visits, outpatient care, lab tests, preventive services like screenings, and medical equipment. This part has a monthly premium. Think of Part B as coverage for outpatient services. Part C, or Medicare Advantage, combines Parts A and B and often includes Part D. These plans are offered by private insurance companies and may provide extra benefits like dental, vision, hearing, and wellness programs. Some even include coverage for meals or transportation. Think of Part C as placing all your parts into one policy. Part A plus Part B plus Part D equals Part C. Part D helps pay for prescription drugs. It covers medications based on a plan's formulary, grouping them into cost levels, also known as tiers. You'll have a monthly premium, and your costs will depend on the coverage stage you're in, from initial coverage to catastrophic coverage. Think of Part D as drug coverage. Medicare offers flexibility, but understanding your options is key. Need help choosing the best plan for your needs? Contact us today. We're here to help. Understanding the costs of original Medicare is essential for planning your healthcare budget. Part A is usually premium-free if you or your spouse worked and paid Medicare taxes for at least 10 years. However, hospital stays have deductibles and daily coinsurance costs after 60 days. Part B requires a monthly premium, starting at $185 in 2025 for most people, and includes an annual deductible. Once the deductible is met, you typically pay 20% of the cost for services like doctor visits, outpatient care, and lab tests. One key difference with original Medicare is that it doesn't have an out-of-pocket maximum. This means there's no limit to what you might pay for covered services in a year. To manage these expenses, many choose supplemental coverage like Medigap plans or Medicare Advantage Part C plans, which can help cover deductibles and coinsurances. Planning for these costs ensures financial peace of mind. Have questions? Contact us today to explore your options and find the coverage that fits your budget. While Original Medicare provides essential coverage, there are key gaps to be aware of. For instance, it does not cover routine dental, vision, or hearing services, which include exams, glasses, or hearing aids. Prescription drugs are also excluded unless you enroll in a separate Part D plan. Additionally, long-term care, like nursing homes or in-home assistance, is not included. Medicare also doesn't cover healthcare services outside the U.S. or routine physical exams. Only a yearly wellness visit focused on prevention. To fill these gaps, many beneficiaries opt for supplemental coverage like Medigap or Medicare Advantage plans, which can include extra benefits like dental, vision, and hearing care. Knowing what Medicare doesn't cover helps you plan for unexpected expenses. Need guidance on filling these gaps? Contact us today and we'll help you find the right solutions for your needs. Original Medicare is a great foundation, but it leaves gaps that could lead to unexpected expenses. Luckily, you have options to enhance your coverage. Medigap plans. These help cover extra costs like deductibles, co-payments, and coinsurance. For example, if Medicare covers 80% of a doctor's visit, Medigap can help with the remaining 20%. These plans offer predictable costs and flexibility to see any provider who accepts Medicare. Medicare Advantage, Part C. These plans combine Parts A and B and often include Part D. They may also cover extras like dental, vision, hearing, and wellness programs. Some even provide unique benefits like transportation or meal delivery. These plans often work with specific provider networks. Part D, Prescription Drug Plans. These plans focus on covering medications, helping you afford essential prescriptions. Need help choosing the best option for your needs and budget? Contact us today. We're here to guide you every step of the way. Medicare Part D helps you manage the cost of prescription drugs, ensuring access to essential medications without overwhelming expenses. These plans are offered by private insurers and include a formulary, a list of covered drugs organized into tiers. There are usually 5 tiers. Lower-tier drugs like generics usually cost less, while higher-tier drugs like brand names and specialty medications are more expensive. Part D has 3 stages of coverage. The deductible stage: you pay the full cost of your prescriptions until reaching your plan's deductible. In 2025, the standard Part D deductible is $590. The initial coverage stage starts after the yearly deductible is met. You share costs with your plan through co-payments or coinsurances. It's important to note, a copay is a fixed amount you pay per prescription, while with coinsurance, you pay a percentage of the cost per prescription. Catastrophic coverage stage. After reaching the yearly out-of-pocket limit of $2,000, you no longer pay for costs of prescription drugs. Imagine taking a life-saving medication that costs hundreds of dollars a month. With the right Part D coverage, your cost could drop significantly. Choosing the right plan depends on your prescriptions and budget. Need help navigating the options? Contact us today to find the plan that works for you. Medicare offers specific enrollment periods to help you secure coverage or make changes. Missing these windows can lead to penalties or gaps in care. Initial enrollment period, IEP. This 7-month window starts 3 months before your 65th birthday, includes your birthday month, and ends 3 months after. It's the best time to enroll in Parts A and B. Annual enrollment period, AEP. From October 15th to December 7th, you can switch Medicare Advantage or Part D plans for the following year. Open enrollment period, OEP, runs from January 1st to March 31st, where Medicare beneficiaries, specifically those enrolled in a Medicare Advantage plan, can switch to a different Medicare Advantage plan or return to Original Medicare. General enrollment period, GEP. If you missed your IEP, you can enroll in Parts A and B from January 1st to March 31st, but penalties may apply. Special enrollment period, SEP. Life events like losing employer coverage or moving allow you to enroll outside standard periods. For instance, if you retire after 65, A special enrollment period ensures you can get coverage without penalties. Understanding these timelines is crucial for avoiding coverage gaps and penalties. Ready to secure your Medicare coverage? Contact us today for personalized assistance. Choosing the right Medicare plan is a personal decision based on your health needs, lifestyle, and budget. Consider these key factors. Costs. Are you comfortable with premiums, deductibles, and out-of-pocket expenses? Look for plans that match your financial situation. Coverage. Do you need additional benefits like dental, vision, or hearing? If you take medications, ensure the plan includes Part D or purchase a standalone Part D plan. Flexibility. Are you okay with a network of providers, or do you prefer the freedom to choose any doctor or hospital that accepts Medicare? Health needs. Do you require specialized care for chronic conditions, or are you focused on preventive services? For example, a Medicare Advantage plan can offer more benefits but often limits you to a provider network. On the other hand, Original Medicare with Medigap offers flexibility, but comes at a higher cost. Your plan should align with your priorities and give you peace of mind. Need help deciding? Contact us today for expert guidance tailored to your needs. Timing is everything when it comes to Medicare. Delaying your enrollment could lead to lifelong penalties that can impact your budget. For example, Part B, penalty. If you don't sign up during your initial enrollment period and don't qualify for a special enrollment period, you may face a 10% premium increase for every 12 months you delay. Part D, penalty. Missing your enrollment window for prescription drug coverage results in a 1% penalty for each month you go without coverage, added to your Part D premium permanently. These penalties are avoidable by enrolling on time or maintaining creditable coverage through an employer plan. Don't wait until it's too late. Planning ahead protects your health and finances. Still have questions or need help? Contact us today and let's make sure you're covered without any surprises. If healthcare costs seem overwhelming, you're not alone. Many programs can help reduce expenses for Medicare beneficiaries. Medi-Cal, also known as Medicaid, is a joint state and federal program that helps cover medical costs for individuals with limited income and resources. Medicare savings programs. These cover premiums, deductibles, and co-insurance for Parts A and B. Eligibility depends on your income and resources. Extra help for Part D. This federal program lowers prescription drug costs, covering premiums and reducing co-payments. Patient assistance programs. PAP. Usually offered by prescription drug manufacturers, provide free or lower costs of certain prescriptions for people who are underinsured or don't have insurance. To qualify, individuals must meet certain income requirements. For instance, a client with limited income can save thousands annually by enrolling in both Medicare Savings and Extra Help. We have helped dozens of people learn about and enroll in these programs. Exploring these options can bring peace of mind and financial stability. Unsure if you qualify? Contact us today to find the programs that work for you. Finding the right healthcare provider is an important part of maximizing your Medicare benefits. If you're enrolled in Original Medicare, you can visit any doctor or hospital that accepts Medicare, giving you broad flexibility. However, if you have a Medicare Advantage plan, you'll need to choose providers within your plan's network, which could include doctors, specialists, and hospitals. Here's how to choose the right provider. Check the network. Use your plan's online directory or contact their support team to find in-network providers near you. Consider your needs. Look for providers experienced in treating any chronic conditions or specific health concerns you may have. Call the provider's office. It can be very beneficial to call the provider's office before selecting them as a primary doctor. Calling to confirm they are accepting new patients, have timely appointments, and are currently accepting your insurance can save you time and a headache. Provider directories can be difficult to maintain. Checking with your provider of choice first is always a good idea. For example, if you need an appointment soon, ensure your new doctor can see you within your desired time frame. Need help navigating your plan's network? Contact us today, and we'll guide you step by step.